Good morning. My name is Emily Easton. I'm the recruitment coordinator for Four Oaks Family Connections. And this morning we're talking about BHIS services. Some of you may or may not have heard of those, but Ben, why don't you go ahead and introduce yourself and tell us a little bit about what you do for BHIS?
Yeah, thank you so much, Emily, for having me this morning and taking the time to chat a little bit about the services. So, yeah, to start off with, BHIS is an acronym for Behavioral Health Intervention Services, which are voluntary services provided by trained and compassionate care coordinators. Sessions are provided in the home generally, the child's least restrictive setting, to work on behaviors and skills the children may be struggling with. BHIS services include individual sessions with the children, as well as family sessions to address issues kind of surrounding anger management, verbal and physical aggression, defiant behavior, problem solving and decision making skills, coping skills for dealing with various things that come up in life, and social skills as well, struggling to interact with adults or peers.
Yeah, that's a great list. I mean, I think even as adults, we need some of those things on that list, right? So, uh,
Absolutely.
I mean, we all need those upgrades once in a while. So, yeah, that's great. That's a huge list of services, and a lot of the kids in our care struggle with those things. And like you said, it's in home, so foster parents would expect someone from BHIS to reach out to them and schedule a time
Yep.
to come to their home. Is that what that would look like?
Yeah, correct. So services can be provided in the office or in the school setting based on the child's needs as well, and in cooperation with the school district. Some schools allow the BHIS providers in and some schools don't. But yes, we would be in touch as far as where those sessions would occur, and typically they are in the home.
And do you work in partnership with birth families when it comes to BHIS? Can you talk a little bit about what that would look like between foster families and birth families and all working together?
Yeah, absolutely. So, as we know, there's a big team approach when working with children that are in the Department of Human Services care and system. And so, we work very collaboratively with all the partners that sit around the table, and, each situation is going to be different from the next. However, if there's a reunification goal, our efforts are also going to be with the biological parents, but we're also there to support and assist with things going on in the foster home as well, because we know children can struggle, being removed from their home and being away from their parents. But we do want to help make that placement a successful one for the time that those children are in care. We would collaborate with the foster parents just in regards to, what that would look like. And in order to communicate and talk with them along with other partners around the table, we do need, signed releases of information from the birth parents or whoever the guardian is at that time. There are times when children are in foster care that the parents aren't involved in the department, or DHS is the guardian, and so they can sign off on that paperwork if that is pertinent to that situation. But in regards to consent for treatment and release of information, we always need parents' okay and signature. So.
Yeah, that's really helpful information because some of our new foster parents are trying to get their head wrapped around all these services and know kind of the logistics of all those confidentiality pieces. So I'm really glad that you shared that. And then does BHIS stay with that child after reunification as well? Is this a service that continues?
So it really depends on the timeline, with the MCOs, so the managed care organizations coming in and overseeing Medicaid. So that would be AmeriGroup and Iowa Total Care. It depends on when we would be involved. If we're involved before that child is removed from the home or in care, BHIS is really meant to be a short-term service. So anywhere from realistically 12 to 18 months is 18 months is typically the most. 12 is pretty average. We really shoot to be in and out within that 6 to 12 month time frame. We have pretty identified goals, that we developed during the mental health assessment with our LPHA, that we are there for these reasons, and these are the things we're going to work on, and hoping to help the family be able to implement and internalize those skills in a way that's quick so we can kind of get in and get out. If we're in the middle of services, we would follow that, child where they're going, whether that's between placements or between the foster placement back to the biological placement, or depending on when we're involved, from the biological placement to the foster placement as well. Again, needing, you know, the appropriate releases of information in order to communicate with those individuals. But it really just depends how long we've been involved and the biological parent's willingness to continue with the services. It is a voluntary service. So if the biological parents, you know, don't want to participate or don't want the service, you know, we do have to discontinue our services. So it really, you know, kind of just depends, but we do follow the child. If they were to be moved from placements in regions, you know, we work with our team kind of across the state to be able to transfer those services to a different care coordinator in the region that that child has moved to, or we'll stay with them if they're in a close enough proximity to where they were.
Yeah, it sounds like you guys work hard to maintain that stability whenever that's an option. So that's great. So you
Yes.
mentioned a couple things I have questions about. If I'm a new foster parent and I don't know what LPHA is, can you tell me that?
Yeah, that's basically our therapist. Sorry. So those are the credentials in order for a therapist to be licensed, and they would do the mental health assessment at our office, or right now via telehealth, depending on the needs and wants of that family. So yes, sorry about that. Throwing
No, that's
acronyms.
okay. I just remember when I was first licensed, I felt like it was alphabet soup. Like I just would get all of these acronyms and I was like, wait, who are you? What do those letters stand for? So we're just clearing those up as we go along.
Yep.
And then you mentioned also, you talked about Medicaid and things like that. So just hitting on the idea of these are free services. These are covered um, by, you know, state health care, things like that.
Yep.
Um, would a foster family need to do anything to make those claims? What does that look like just as far as finances and things like that?
Yeah, as long as the child has Title 19, which typically in any situation in which a child is removed from their home, they get Title 19. So that is a Medicaid service. BHIS services are covered 100% under Title 19. However, we do have a private pay option for those that don't have Medicaid. However, all kids in the child welfare system, if they're removed, have Medicaid. The process kind of looks like, you know, if you're interested in the services, or the, you know, children in the home are experiencing behaviors or having some issues of any kind, really your first stop is to talk with the in-home worker. You know, and depending on what area you're in will depend on what agency would provide that service. So here in the East, that's Families First and Lutheran Services of Iowa, so LSI. Um, Talking with those individuals about agencies that provide that service in the area, and they can also help make those referrals. So I know here in Dubuque, for instance, if a foster family were to express interest in that and talk with the DHS worker could then help resource them in the community. If the biological parent is still the, you know, guardian and has their parental rights, DHS or the in-home provider would have to talk with the biological parent as far as whether or not they're okay with this service and whether or not they would like to participate in it moving forward. But typically all it takes to get the ball rolling is just to start having those conversations. You could even contact, you know, a local BHIS provider in your area, and you can get that information from DHS, Four Oaks, other community partners that are aware of those things. Um, Once the referral is made, uh, internally, you know, the intake office will schedule what is called the mental health assessment. The biological parent and the child, or if the biological parent is okay with the service but doesn't want to be present, as long as there's a release of information, the foster parent can be present at the assessment with the child, as long as all releases and that fun stuff is taken care of up front. And that assessment really is, you know, going over various issues that the child's having. They'll do a couple different assessments using some assessment tools. And then following that, the therapist or LPHA would then submit that request to the managed care organization, so the MCO, whether that's a Group or Iowa Total Care. Usually takes about 5 to 7 days, business days, and also depends on the influx of referrals at that time for them to be able to review it, to get a notice of decision on approval or denial for the service. Um, Following that, once we get that, our care coordinator contacts the individuals in which we will be working with, which can be the foster parents, the biological parents, and the child, and work on scheduling those appointments. As far as what services look in home every week, you know, it's hard to say there's a typical, but if we had to say there was a typical, typically it's an hour with that child individually and an hour of family time as well. And we can split that family time up or do what we need to do to make sure that the situation in which the problems arose or where we're helping. And so, you know, it could be a mix of the biological home and the foster home. It could be, you know, more towards the foster home or more towards the biological home. It really just depends, again, on the situation. But that's kind of what you can expect as far as what weekly sessions and timeframes can look like. You know, we could get a half an hour of one code and 45 minutes of another. So it really just depends what the MCO needs of the child, age of the child are all dependent on. So
Yeah.
sorry, that was kind of long-winded.
No, that's okay. We need all the information, so that's great. You mentioned age of child. Kind of what is the age range of youth that you guys serve?
That's a really good question, and something we are often navigating as well. Typically, again, if we had a typical or a normal, we look at anywhere from 5 to 18. Children under the age of 5, you know, have been referred and approved, but really what we're looking at there is the developmental and cognitive abilities of that child and whether or not BHIS would be an applicable service. Typically for children that young, you know, we're looking at play therapy, theraplay, and those types of services in the therapy realm that are a little bit more appropriate for the ages of those children.
Right, right. Um, as a foster parent, if you know, if as I'm interacting with a BHIS worker, what are the things that are really helpful? What should I be sharing about when it comes to communication?
Awesome, good question. Yeah, behaviors are really important just as far as being able to articulate what the child is doing in situations that they're doing it. Along with school behaviors, how are they doing in school, strengths that the child has, that things that you've really found to be effective or work, things that you've tried that maybe aren't so successful, so we don't try to repeat some of the same things. Really any information pertinent to that child's behavior, whatever, you know, if they share things with you, as the foster parents, you're more than welcome to share those things with us. Sometimes children, you know, have a hard time delineating reality from some of the things that they think and feel. And so just know that, you know, if they tell you something, you know, it doesn't always make it true or accurate, but it's coming from somewhere, some place that they feel, maybe some trauma they've experienced. And so communicating any of those types of things around the child with us is good, whether that's sleep patterns and behaviors, eating patterns and behaviors. You notice specific patterns that come up in play between the child and other, you know, children in the home or the child and adults. Parentified behaviors, nice for us to be able to know. So whether or not they're trying to take on adult responsibilities, that's something, you know, we typically want to work on the child with and help a child be a child, right?
Right.
Not worried about all these other things that are going on around them. So all of those things are pretty pertinent, along with probably some other things I didn't mention.
Well, yeah, and you mentioned just anger management, coping skills, putting in maybe behavior plans is the wrong word, but solutions that you can implement in your home to help. Or if there's, I think of like if there's certain times of the week or certain times of
Yeah.
the day that you know are more difficult for a kid, kind of problem solving some of those things
Yep.
is all stuff that I'm hearing you say is a good thing to have BHIS work through it with you
Yep.
and talk with you about those sort of things as a foster parent. Yeah, that's really helpful. All the things that you are mentioning are things that, you know, are really common for the youth in care. And so being able to have somebody come alongside them is super valuable. And just for our new families, understanding kind of what that role is so they can use them really well, you know, is what we're communicating today. So I'm really, really just thankful that you were able to share that with families. Is there
Yep.
anything that we haven't talked about that you just want foster families to know?
Yeah, I guess in regards to BHIS services themselves, since we've seen a change to the privatization of Medicaid here in Iowa, it's always been pretty important, but BHIS does partner really well with therapy. Typically, the skills that we're working on, therapists are touching on a deeper level. And so even with getting authorizations or extended authorizations, the therapy component is pretty important in ensuring a holistic approach to working with the family
Mhm.
services and ensuring that we're touching on all the realms we need to help sustain the implementation and learning of skills that we're working on moving forward. So
Yep. And do BHIS workers, do they have a set curriculum? Do they kind of, how do they sort of choose how to spend that time?
yeah. So during the mental health assessment, the therapist and the foster parent, or the therapist and the biological parent, will work on and identify some goals. And so, again, we have kind of a narrow focus on those goals. And then the therapist and our care coordinator, myself and our care coordinators, would then collaborate on what curriculum and skills and interventions to utilize. We do endorse a lot of evidence-based programming skills and interventions, such as the zones of regulation,
Mhm.
uh,
Mhm.
Boys Town curriculum teaching social skills to youth, 1, 2, 3 magic, those types of things. We do have access. We have probably a couple hundred different resources internally here at Families First that we utilize. And those curriculums would pair with the child's goals and the different behaviors and things that they demonstrate, um, that are problematic, and the reason that BHIS got involved. So,
Yeah, yeah, that's great. For all of our, as I teach CHIPS map classes and things like that, I always say, like, we can't, as foster parents, we can't be the expert in every single thing that we open our doors to, right? So
yep,
there's a lot of unknowns, and knowing that, BHIS is there to support us, and we don't
yep.
have to have all the answers every single time, I think is really helpful and comforting, knowing that, we as foster parents, like, we can do this because there are people like you that are coming alongside, to
Yeah, the team approach, Emily, is just really
yeah,
important. Everybody trying to be on the same page, and everybody there to support the children, the placement, the biological home, and parents. It really is effective when the team takes that holistic team approach. So,
yeah, yeah, that's great. Any final words before we end our session this morning?
no, I don't think so. I just, if you have a child in your home that's struggling, reach out to individuals in the community, and try to find that BHIS resource. We do, like I said, partner with everyone the best we can, and are really there to support, the children, the foster families, the biological families, and help things move forward as good as possible. So, thank you for having me on this morning, Emily, and asking a lot of really good questions. We are grateful for that. So
Yeah, thanks so much for spending the time with us, and for all of the BHIS workers and all the support that you guys provide foster families. We really appreciate it.
thank you. I appreciate it as well.